Good evening. Assalamu alaikum. Peace be upon all of you. Thank you for those of you who are joining us this evening. My name is Oussama Mezoui. I am the CEO here at Penny Appeal USA. This evening, we have the honor of hosting a guest live from India, Dr. Taha Mateen, to talk a little bit about what's happening, what's the reality on the ground. Of course, by now we're all aware of the tragic COVID outbreak that's happened in India these last couple of weeks. Every day we're seeing new records broken when it comes to deaths, when it comes to infections. Of course, India now is grappling with this latest surge in COVID cases, COVID deaths, and the aim really of this conversation, informal conversation today, is to just find out the reality on the ground. What is the need? And for us to educate ourselves about that reality. With me today is Dr. Taha Mateen. He is a medical doctor, a physician at the Akira Hospital. Dr. Mateen is also a managing trustee of the HBS Hospital. He is continuously mindful of poverty and other social justice issues in Bangalore, India. He's also involved in numerous non-profit organizations and charitable projects. During the beginning of this pandemic, his video pleading for doctors to join the front lines went viral and was seen by many, many people on social media. As India experiences this new wave of COVID-19 cases, Dr. Mateen continues to be on the front line, and we're really honored to have him join us in what is a very busy schedule for him. So Dr. Taha Mateen, Assalamu alaikum.
Alaikum assalam warahmatullah. Good morning and good evening, all of you guys.
Thank you so much, Dr. Mateen, for joining us. I know you've had a really busy few weeks and a busy schedule, so we're honored to have you. First and foremost, what time is it there in Bangalore?
It's about 8:45 in the morning.
8:45. So inshallah, you're having a good morning. Of course, it's Ramadan. So is today the last day of fasting, or is that tomorrow?
Today is the 29th of fasting, and okay, we perhaps have one more day.
Thank you, Dr. Mateen, again for joining us. Of course, everyone I think is aware of the reality of COVID-19 and the latest outbreak in India. We saw some early reports in the US media in the first few days. Unfortunately, that media has died down. The aim of today is really to get an update on that reality and what's happening. So, of course, you are on the front lines, you're seeing patients, you're managing a hospital. First question really, Dr. Mateen, is what is the latest? Every day we're seeing new numbers, new records, unfortunately being broken. I think I saw 420,000 plus official infections a day. Tell us a little bit about the reality of status quo and the numbers in the last couple of days.
Well, those are national figures and are probably right, 420,000 and probably a lot more. However, the death rate is grossly underestimated. People are dying and dying and dying. We've had families, I had a 20-year-old boy, both parents died, and now he was frantically looking for a bed, and we are putting that guy in. There are pregnant mothers who are kind of dying, and there are pregnancy at term, which is delivering, and then the mothers die. It's a pathetic scene right now. There's devastation of a it's difficult to estimate what this whole thing is about. We have not reached the peak, and it's increasing. It hasn't plateaued. It hasn't reached its peak. And I have lost my business partner. I have lost my auditor for 20 years. I have right now a cousin sister of mine is on a ventilator. I don't think she'll survive. So it's very personal. And if I went to the burial ground the other day when one of my friends passed away. First time I went a week ago, in 15 minutes, we had 3 bodies coming in. Yeah, last week, 3 days back, there were 16 bodies that we counted in those 15 minutes that we were standing there. This is a Muslim burial ground. Just one of those, we have like 5 of those in the city of Bangalore, which are accepting COVID deaths. So, the numbers are grossly underestimated, and it's simply a devastation I cannot describe at this point
Let
of
me
time. Yeah.
ask you, Dr. Mateen, we've known about COVID globally since March of 2020,
Right.
over a year. How did we get to this point in India? What were some of the issues that led India today to have this peak?
Well, these are mostly speculative, but one thing is for sure: we did not prepare for it on a national level. Expecting a second peak or whatever. We suddenly ran out of oxygen. We ran out of medicines. We do not have beds with oxygen that are sufficient to face this challenge. We do not have ventilators. We do not have oxygen concentrators. So, and we do not have the staffing. Staffing has been also a major issue, wherein people in the mood of self-protection are hiding up at homes, and the medical and healthcare professionals are not available in good numbers to face this crisis. So staffing is a problem, and then hospital beds are a problem. Oxygen in hospitals is a problem. Medicines are a problem, and something as simple as face masks in which to give oxygen are running out, and there's a
Mm.
shortage. We have to keep searching here and there. So people
So,
are, yeah.
yeah, no, that sounds tragic. And of course, I'm sorry for your loss. You know, what's amazing about COVID is that you speak to anyone all over the world, they will have lost someone. You know, I am ethnically from Algeria, and my father lost his only maternal uncle and the son. So my father lost his only maternal uncle and his cousin in Algeria to COVID. And so it's amazing. It's this global pandemic. One question I had, Dr. Mateen, was for those of us not familiar with the health infrastructure in India and the health system in India, I assume that those with wealth, those with money who can afford it, go to private hospitals. Is that correct? What about those who can't afford it?
It's predominantly privatized healthcare in India. The government infrastructure is kind of highly inadequate in terms of its capacity as well as in its quality. And therefore, the government is trying hard to, 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 um, to kind of say to all the private hospitals that 50% of the beds should be given to government, but not necessarily to the poor people. So people with influence, people with money get to go into private hospitals under government quota, and the others do not have this privilege, and
Mm,
therefore the poor suffer a lot. But let me tell you something interesting this time. The first wave had a lot of poor people. It was almost 80% poor and 20% middle class, and now the ratio is reversed. It's 80% in the middle class, and it's only 20% poor. However, you should realize that whether poor or rich, this virus is a very, very democratic, secular virus. It affects
mm.
everybody, and everybody is in the same trouble. It's a humanitarian crisis, and I don't think we should look at it from a class angle.
Absolutely.
Everybody is for it. Yeah.
Absolutely. You know, one of the things, Dr. Mateen, in the US, of course, we've been hearing for 14 or 15 months now is social distance, you know, keeping your distance away from people, 6 feet. Of course, that may be easier in a country like the US. The reality, though, you know, I've traveled not to India, but I've traveled extensively on our projects globally. And we know the reality that in many working class suburbs and communities in South Asia, that social distancing is a privilege that many people really do not have. You're talking about dense populations. And so, you know, let's talk a little bit about that. I mean, how do you stop yourself from getting COVID in the context of a city like Bangalore or Delhi or Mumbai?
I think social distancing is important, but not very practicable in every situation in India, like you said. But since this virus is a oronasal respiratory virus, that's how it spreads. I think a decent mask is a very, very, very important thing to wear. Having said that, uh, the mode of transmission is very, very peculiar. You cannot just hang it up on a social distancing formula and hope that that's the only way. That's unfortunately not the true practical story. Although that's not to underestimate the importance of social distancing and a mask, but a reasonable amount of social distancing, where at least the minimum we can do is not have too many unnecessary crowds like marriage functions, different celebrations, elections, religious gatherings in huge numbers and in highly concentrated gatherings. I think those avoidable gatherings should be strictly avoided, and we should
Right.
do our best to maintain a decent kind of social distancing.
We're hearing from many of our partners on the ground who we're working with that PPE, of course, there are massive shortages. Is that what you're seeing too?
No, actually, in India, there is these PPEs are not those kind of very strict PPEs, but we do get PPEs. India is a big manufacturing base,
Mm.
and we've been quick to manufacture PPEs. PPE shortage is not, although affording it is a challenge in those numbers, but availability that has not been a challenge, at least in the city of Bangalore right now.
Okay, so what are you identifying for you in your hospital, your daily interactions? What are the shortages? You mentioned oxygen already. What else are you
Correct.
seeing in terms of shortages and where the need is?
Well, I actually started off with staffing. I think there's an
Mm,
urgent for staffing. I think we need to have something like doctors without borders and nurses without borders, people who can move and say come into the front line and be mercenaries and legionnaires who can come and fight this. There are not too many people in the world who would risk their life to save other people. I think we need to instill that into people that in saving other people's life, we save ourselves. Yes, we lose a few people, but we need that daring group of people. People want to be behind these screens, on online chats and online things, and that's not bravery. Right now, we need a lot of courage. People need to come in. So a lot of encouragement needs to be done to staff. Secondly, what is happening in India today, at least in Bangalore City and in most places, there is too much of medical advice available on the social media, and medicines are freely available in pharmacies. You do not have a strictly prescription-based giving. So everybody has medicines. Everybody, a lot of them have oxygen cylinders. So they take symptomatic treatment at home with some quacky medicines and some cylinders, and finally, when oxygen saturation, and they have pulse oximeters, so they know a little bit thanks to Google and WhatsApp. So they stay home without getting treatment with steroids and other things. They stay home taking paracetamol, Tylenol. They keep checking their pulse saturations, and then they take oxygen. When oxygen saturation falls to below 60 on an oxygen mask, that's when they start looking for ICU beds. And ICU beds are not available in those good numbers. So we need a lot of patient education to tell them to come out into to get treatment from doctors who are treating COVID, and to reduce this number. So what we have done in Bangalore City today is created a lot of outreach COVID clinics, so that, and a online clinic, so that people approach us on the phone and we start treatment as soon as possible. Once we do that, and when home care is not possible, when oxygen saturations are dropping, the first level of care is at home. A lot of people are mildly symptomatic and asymptomatic. Those people are treated at home. Once they go beyond that, we have to create a lot of oxygen beds. So we are taking a lot of hotels and school auditoriums and converting them into beds where we can give them some basic level of intravenous steroids, checking sugars and correcting them, as well as giving them oxygen from 5 to a maximum of 10 liters of oxygen per minute. Now, again, 80% of these people do very well with that kind of treatment. 20% of them get worse and they need more intensive treatment. So we, at the moment, are running HBS Hospital, Alameen Hospital, another War City, hotel-like thing, and we are looking at expanding these further, where an intensive care environment can be created. We are using oxygen concentrators in these large bed capacities. At the moment, we have about 200. We need to scale it up to another 300 additional beds in the next few days. We are doing this across the state of Karnataka in different districts. We have one in Hassan, one in Kalburgi, that's Gulbarga, that we used to be named as. And we are in the process of doing this in another 3 centers across the state of Karnataka. And hopefully to spread it out, we work on a platform called Mercy Mission, which is a conglomerate of about 25 other similar groups, which have conglomerated, gotten together across the state of Karnataka, and we are trying to create these multiple levels of home care and then oxygen beds, which are kind of temporary field hospitals. Just put beds, have oxygen concentrators, have oxygen cylinders, and have nurses who can give them some intravenous medicines, and check their sugars and also give them oxygen. A lot of need gets settled there, and then create intensive care beds with intensive care nurses and doctors. That's also not a big deal, but then that's a capital intensive thing. Ventilators are not available to get, and therefore we are putting monitors, intensive care beds, so that we can do that. So our target is to have at least 200 extra intensive care beds now, 2,000 extra oxygen beds, and have about 400 volunteers manning COVID clinics, outreach clinics, as well as online helplines. We have a
Mm.
helpline and clinics also. So we're in the process of scaling up, and we expect this to go on for another 2 months, actually.
So that was my next question, Dr. Mateen. I know it's impossible to guesstimate or to predict how something like this goes and the patterns of COVID and an outbreak. What are your predictions, however, if it's possible to make any, for the next few weeks? You said earlier at the beginning that you feel or you think we have yet to reach the peak
Right.
in India. What's your outlook for the next few weeks?
Based on what we saw in the previous wave in the second half of 2020 last year, we had that from 1st of July all the way to the end of December, is what our hospital was full for those 6 months. However, the peak of the wave, so to say, we are expecting this to go on for another month at least, and then to plateau off, and then have a tail end for another 2 to 4 months. So a total of 6 months. We've just been 1 month into this, and that is how it looks. So the hospitals and the ICUs are going to be full for 6 months. However, the oxygen beds that we create are not going to be in demand after about 2 months. But for those 2 months, like you said, there is only so much you can do. No amount of work you do now seems adequate at all. Therefore, do what we can, and that's what we are, consciously responsible for. That's what we are mukallaf about. So we do
Yeah.
what we can, and then yes, some of these may not be utilized fully, but we do it because it's an emergency now, and it may last for about 2 months. Osama.
You know, those of us in the US, obviously, the US experienced some of the worst cases in the world when it came to death rate, when it comes to uh, infection. My wife is actually a physician like yourself. She was on the front lines, and so this was something that was very close to home. And luckily we are in America, and we have some of the best healthcare that money can pay for, and there are ventilators, and there have been this infrastructure in most places. Of course, there were shortages in New York and elsewhere, but for the most part, we live in a very developed nation with access to lots of infrastructure. So one can only think about what it's like for those in the villages and smaller towns in India who don't have the infrastructures that we had in Chicago or New York or in DC, where I'm based, and just the extra challenges that come with the lack of infrastructure. Is there any type of lockdown at the moment, Dr. Mateen? Is there any attempts at locking down?
At the moment, we are in complete lockdown. I mean,
Okay.
there is no movement at all on the streets except the bare minimum that is required. So we are
Okay.
in complete lockdown in the state of Karnataka and in many other states in India. And I live in the southern part of India. Karnataka belongs to the southern India, and southern India is far more developed in its health infrastructure as compared to the northern country.
Mm.
We have a state called Uttar Pradesh and Bihar and Madhya Pradesh. These are highly populous states, very poor states with bad infrastructure. There's a very famous university in India called the Aligarh Muslim University. It's more than a 100-year-old university where we have lost 12 sitting professors in the last 2 weeks.
Mm.
Senior professors have died, and another 2 dozen, another 20 of them emeritus professors, senior professors, old men who have died to this illness. So these are places where medical facilities are extremely poor. The scenes that we see out there are pathetic. So people from South India are also having that burden of doing something out north also. So we are thinking loud once we kind of plug in what we can do down south. And once we have enough numbers of, in terms of staffing, we want to go up further also. And there are talks about a third wave. God forbid, but still, looking at international experience, it looks like a major possibility that we should consider and build up at least now. Putting in oxygen generator plants, putting in large liquid oxygen capacity building to hospitals. We have created in Bangalore something called the United Hospitals Group. About 4 or 5 Muslim hospitals have gotten together. We have created a lot of oxygen capacity. And every time we get a SOS call from other hospitals across
Mm.
the city, they say our oxygen is running short. We have oxygen for just 2 hours. After that, our patients are going to die. Remember, many hospitals in India ran out of oxygen, and people on oxygen died in great numbers. In Karnataka, 36 people died in one hospital in 2 hours because of shortage of oxygen. There are many other hospitals where people have died suddenly because of oxygen. So we have created a united group here and have a pool of oxygen cylinders, which we go in an emergency and supply to these hospitals so that they can tide over that crisis for 1 to 2 hours or 4 hours, and then they get their own oxygen. So a lot of things are happening here. I think it needs to be augmented and supported so that together we respond to this as one people, whether we stay across the globe or wherever we are. We are one people. We are going to be asked that one person was gasping for oxygen. What did you do? Did you find God? Did you find your maghfirah? I mean, where were you when all this was happening? Um, uh, I mean, we do what best we can,
Yeah, and
not responsible to save the whole world. So let's do
absolutely,
what we can. Yeah.
you
And
know,
plan for the future at full capacity.
right.
Yeah.
And first and foremost, of course, may Allah reward you for your efforts. It's Ramadan. You're on the front lines. God knows how difficult this has been for you personally and for your colleagues. And we really thank you on behalf of humanity, and may Allah reward you for your efforts. Final question, and I'll let you go. I know you have a busy day ahead, Dr. Mateen. For those of us who are watching in the United States, what would be your final remarks to Americans who are looking to help? And those who are here thinking or feeling a little bit hopeless? Many have family in India, many have friends in India. What would be a kind of final remarks for those watching this evening?
I think people with faith should understand that um, in protecting others, there is protection for us. In taking care of other people's lives is saving our own life, and that's a principle that we need to understand. We may be separated by distance, but we are jasadun wahid, one body. And anybody feels the pain across the globe, we need to feel that pain within ourselves. It is us who is dying. It is your brother, your sister, your mother, your uncle who's dying. And it's terrible. And that could come to us in any other form. The one of the best ways of protecting ourselves, ensuring ourselves from any such tragedy in the future within us is to rise up at this occasion, try to help and hold hands. Who knows? Maybe we need that someday. And anyway, all of us are going to die one day, stand in front of Allah subhanahu wa ta'ala, and we are going to be questioned about this. So if we are searching for our maghfirah, our forgiveness on that day, we are going to be individuals then. And let us search for that maghfirah, search for that jannah in whatever, whichever way we can, as little as possible. I think we need to go ahead and have a feeling that at the global level, we are all one, we support each other, we are one family. And I think that concept, if that comes through these webinars, it gives us a lot of energy to work in the field and give encouragement to our co-staffers, people who are working with us, looking at death and death and death, grief upon grief upon grief is very depressing. You need a lot of sabr, you need a lot of encouragement. So when we come together, I think that makes things easy for all of us. Thank you very much for your support and listening to us and being together with us in this hour
That,
of human need. Thank you.
that was Dr. Mateen, very beautifully said. May Allah reward you. Thank you so much. And I think it's so well articulated. We're in this together. It doesn't matter actually who you are, your ethnicity, your race, your background, your wealth. The COVID-19 has affected people all over the world. And we've all gone through different episodes. We've all lost loved ones. We've all lost friends. And so for those watching this evening, I do encourage you to visit pausa.org/India. We can't help everyone, of course not. But like Dr. Mateen said, if we can help one person, that is really the ambition here, is to help as many people survive this for as long as possible through providing oxygen, through working on the ground and filling any gaps that exist, and working alongside folks like Dr. Mateen, who are really risking their life on the front line day in, day out. So Dr. Mateen, thank you once again. For those of you watching, thank you for tuning in this evening. We hope that was informative. We see from some of your comments that you've really benefited from this. Thank you for watching. Share it with your colleagues, share it with your friends and your family. We want to keep this on the forefront of people's minds. Now, of course, I'm aware this evening as we talk, there are bombs falling on Gaza. Of course, there is the Uyghur issue in China. There are many people all over the world facing challenges, and sometimes we can feel hopeless when you look at the news and you look at what's happening in Palestine tonight, the violence in Colombia, the COVID-19 outbreak in India, what's happening to the Uyghurs in China. The list is long, but the reality is that we are responsible for what we can do. We are responsible for our actions, like Dr. Mateen said. And so if what you can do this evening is donate, is say a prayer, make a dua, these are things that you control. These are things that are in our hands to do. And so again, finally, I do encourage you to visit the website, pausa.org/India, and do whatever you can, inshallah, to help those in need. Thank you so much again, Dr. Mateen. Inshallah, have a great day. An early Eid Mubarak to you and to your family. Stay
Thank you
safe.
so much, all of you.
Thank
Eid
you. Stay
Mubarak.
safe. Eid Mubarak. Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh.